بسم الله الرحمن الرحيم. السلام عليكم. أهلا وسهلا فيكم جميعا بالانترفيو سكيلز وركشوب لهاي السنة برعاية Syrian American Medical Society، وخصوصا هي Education Committee. شكرا جزيلا لحضوركم. في عنا حضور هلأ من أونلاين، حوالي 50 شخص على الأقل، وفي عنا حضور من شيكاغو وديترويت وكليفلاند. هاي السنة طبعا هي السنة رقم 11 اللي عم نعمل فيها هاي الوركشوب. وصلت لهالمرحلة طبعا بجهود أعضاء الإديوكيشن كوميتي وأعضاء ناس صاروا عم يشتغلوا بهالموضوع أكثر من 10 سنين، وجزاهم الله كل خير والله يعطيهم العافية على التعب تبعهم. رح نبلش اليوم الويبينار. رح بلش بترحيب بسيط. بدي أحكي شوي هيك دقيقتين عن السامز اكتيفيتيز. سامز طبعا مثل ما الكل بيعرف انه عم نشتغل خصوصا بالإديوكيشن كوميتي على موضوع تسهيل الماتش على المتقدمين وعلى الأطباء بأسهل ما يمكن، وعم نحاول انه نغطي اكثر الجوانب المطلوبة. اول شيء هي اليوسيميلي ويبينارز، وطبعا بدانا بالاوبزرفرشيب بروجرام، وفي منتورشيب بروجرام كمان. وبداوا من خلال الشهر الماضي الجورنال كلاب اللي عم بيكون بقياده الدكتور طارق يوسف. كمان عملنا خلال هاي السنه اول مره personal statement editing program. الحمد لله في 33 شخص قدرنا نعمل لهم editing للpersonal statement. كان في محاضرات خلال الأشهر الماضية how to apply to residency و applying to residency. كل هدول المحاضرات والويبينارز والlectures كلهم available هي على اليوتيوب channel تبعنا. إذا بتروحوا على اليوتيوب وبتعملوا سبسكرايب وبتشوفوا الفيديوز كلهم موجودين هناك. حتى هذا إن شاء الله راح يكون مسجل، هذا الويبينار، وبينزل على اليوتيوب شانل باسم سامز Education Committee مثل ما كنتم شايفين على الشاشة. الاكتيفيتيز تبع سامز هي على مدار السنة وتقريبا ما بتوقف يعني أبدا، وحتى لما بيكون في عنا شهر شهرين فاضي بنحاول إنه نعبيها بأكتيفيتيز، إما ويبينارز أو وركشوبس. اليوم عندنا الوركشوب انترفيو سكيلز وركشوب اللي هو أهم وركشوب عنا خلال السنة، لأنه بيتضمن عدد كبير من الناس اللي عم يحضروا أونلاين وكمان عم يكونوا موجودين بالأون سايت سيشنز. الله يعطيهم العافية المودريتورز اللي موجودين بثلاث مدن هلأ وعم يشتغلوا بتنسيق جيد، الله يعطيهم العافية. إن شاء الله النكست ويبينارز والوركشوب راح يكون فيها عنا في عنا ويبينار إن شاء الله Are you ready for residency، والوركشوب القادم راح يكون يمكن بجون ماي أو جون. راح يكون residency preparedness اللي هو بيحضر الطلاب ل residency إن شاء الله. بدي أحكي كلمة هيك بسيطة. residency match is difficult. يعني ما حدا راح يقول لك هو سهل أو بسيط، لا it is difficult but it's not impossible. يعني بتشوف عدد الناس اللي عم بيمتشوا كل سنة راح تلاقي إنه ما هو شيء مستحيل، هو شيء كل سنة موجود، وكل الناس عم يجون إن شاء الله مقابلات، وكل الناس عم يجون ماتش بالنهاية. ولكن تحتاج لصبر، وتحتاج لجهد كبير، وتحتاج ل انه يكون الواحد قادر على تحمل كل المشاكل خلال الماتش، لانه الماتش فيه اكيد صعوبات ومشاكل. فتغلب على هاي الصعوبات والمشاكل ان شاء الله بانه كلياتنا نشتغل مع بعض وبنوصل ان شاء الله للنتيجه المطلوبه، اللي هي انه ان شاء الله الشباب كلهم بتمشوا وبالمكانات المطلوبه. ومهمه السامز هي انه نسهل هذا الموضوع قدر الامكان عليكم، ونحاول نقدم لكم المعلومات المطلوبه اللي بتفيدكم بالماتش والريزيدنسي. هلا خلينا ندخل اليوم شو راح نعمل. هيك لمحة بسيطة. أول شيء راح يكون في عنا الويبينار ليكتشرز. أول شيء راح يكون عنا الدكتور عبدالغني سنكري، بعدين محاضرة للدكتور طارق يوسف. بنهاية المحاضرتين في عنا questions و answers إن شاء الله للساعة 12. راح نستمر وبعدين راح يكون في بريك. ان شاء الله بعد البريك بنبلش بالماك انترفيوز. قبل ما تبداوا بالماك انترفيوز المودريتورز بكل مكان راح يعطوكم جنرال انستراكشنز، راح يعطوكم شو راح تعملوا خلال الماك انترفيوز، شو هو الفورم وشو هو structure of the mock interviews اللي راح تشتغلوا عليه، بحيث انه الهدفنا انه كل applicant راح يعمل at least one or two mock interviews و at least he or she will receive enough individual feedback. Or if someone feels uncomfortable at the end of the day, please ask for more mock interviews. If you still feel like you did not achieve what you came for, please ask for more help. Maybe some people they will achieve that from the first mock interview, but maybe some other people may not feel that from one or two interviews. Maybe you need 3 or 4 more. Just ask for it, inshallah, and if there is time and if there are enough instructors, inshallah, they will help you during the day to achieve what you came for. I don't want anyone to go back home not feeling satisfied about the effort and about the mock interviews, is because this is the main part of the day. واهم شيء بدي اكد على الكل انه please give us the feedback. We will email you inshallah all of you a link to Google Forms, or you can access it from your phone or from your computer, laptop. But please give us the feedback before you leave from the location. طبعا هذا this is only for the on-site locations اللي هن Chicago, Detroit, Cleveland. At the end of the day, there will be scholarship interviews. People who are applying for a scholarship, SAM's scholarship, they will be interviewed, inshallah, during the day at the end, inshallah. So I don't want to talk a lot. I'm gonna start with online webinars, and I'm gonna ask Dr. Sankari to be a presenter. And we're going to show his screen. So Dr. Abdulghani Sankari, he's from Aleppo University, and he has PhD from Wayne State University. He did internal medicine residency at Unity Health System in Rochester, New York, and he did a fellowship in PCCM at Wayne State University. He is currently an associate professor at Wayne State University, and he serves as associate program director for the Pulmonary Critical Care Fellowship. Thank you so much, Dr. Abdulghani, for coming and giving this lecture, and I will let you start your lecture.
Thank you, Dr. Muhammad. I hope everyone can hear me well. If you don't, please let me know or let the moderator know, so I can adjust that. First of all, thank you for the opportunity to discuss with you things that you should do and should avoid for your interview day. Every one of us as physician comes to the United States to pursue training, has to go through this process multiple times in your life career. And this could be one of them, one first time, but it's not the last time. So some of these actually advices that I will share with you can be applied for multiple other sets of interviews, and some of them are standard steps that need to be taken when you do a job interview. These are not evidence-based, so these are more kind of personal advices, and may differ from individual to another, but I've collected them through my experience with doing interviews both for internal medicine committee and for fellowship also candidates. Now I'm gonna gear it more toward residency because the audience are applicant for predominantly for internal medicine or other residency programs. I will be honest with you that you need to focus more on things not to do more than things that you need to do, because things not to do, you should never do them. But things to do, you may differ in the circumstances or where you're interviewing, and they are not exclusive. So the objective of this 20 minutes talk, first, to define what is the purpose for the interview. When you are invited for interview, they already saw your application and credentials. Why do they need to bring you in, and how is that going to affect your chance of matching? How to improve your chance of matching? And that is not only on the day of the interview, it's in fact before, during, and after. During the interview, the day of the interview may take up to 50% of your chance. And then I will end with things you should never do in your interview day. And we'll open it later for question and answers. So we start with the purpose for the candidate's interview. Every program United States will have this opportunity so they can know you and you know them. But the key element for the interview is actually the program to know you more than you know the program, because they have much more number of applicants than your applications that you send to seek for interviews. And it's actually every year the number of applicants increasing while the number of spots available for candidates are the same, or probably some of them decreasing. And there is more American grads and also Caribbean grads are applying every year than the year before, which put more pressure on the international medical graduate to be able to secure a spot or to have that chance. But nevertheless, that should give you more motivation to master the skills to do an excellent interview, and that will increase your chance. So you're not disappointed, okay, well, it's really difficult, it's gonna be, my chance is gonna be less, and I'm not gonna. So that's usually should be the more of positive, that you should work harder to get it. And the first thing they look at when they interview you, they want to know your personality. They want to know you as a person, not individual on the paper. And that would go with your attitude, personality, your presence, your intelligence, not only test-taking skills, and your language skills. And that's very, very important for international medical graduates who are studying residency and who are not native English language speaker. Because when you're dealing with patients, they do not want to have complaints about unable to understand or to express or to have poor communication skills. The second thing is they want to go beyond your resume, the application that you send, which was well written, I hope, and it reflect everything in your credentials. They want to know what are the key strength and weakness elements in your personality, in you as individual, that they are going to invest and represent their program in the future. And they want to know you as a person. Are you balanced individual? Do you have anything that you extracurricular activities, or are you able to control your anger? Do you have good judgment on the fly? So these are the things that they are going to expose you to. And every program has their own way of doing that. Some programs, they do group interviews, so they will invite you to a panel where there's 2 or 3 faculty will sit and on the same table with you, and every one of them will ask you a question. Others, they will meet with you individually, one-on-one, and that is more time consuming usually. There is a push, a lot of pressure to do what we call behavioral skills interview. So they ask you behavioral questions, and see your preparation, how you're able to handle such a difficult situation. Are you prepared for the first day of your residency? And finally, they want to have a fair way of ranking applicants. So, and they give a score for every applicant. And that score is based on multiple things. So based on your application, on your how well you did in the interview, and your projection of you. After they saw you, how do they project you in the when you start residency? Are you going to fit? Are you going to be able to adapt well to the program? So they will score you based on that. Did they like you? And that's very subjective. This is why your preparation for the interview is going to make a big difference for that subjective factor in your score. So let's start with the before the interview, where your homework should be started there. You need to improve and sharpen your resume. And a lot of you have already sent their application, so maybe that's a little late now. But for those who can still modify some of their resume or application, be organized, accurate, punctual, and be very careful how you present yourself in that resume. When you're putting also training, try to avoid gaps, and if you have gaps, explain them in an honest way. If you have a year between your graduation and start are coming here, you need to explain why. What did you do that? Or if you have a gap within your medical education in the medical school, you need to explain why that happened. They are going to point at that. Highlight point of strength. And I see that it can be improved. I review a lot of candidates' applications, and a lot of time I advise them to be more. You need to be reflective of what you did and accurately. And that's where your mentor or whoever you work with in the clinical skills or the rotation or the research exposure have to help you in drafting that segment, where it's, or maybe preparing for how you're gonna answer the question about when they ask you, tell us what you did in this research experiment. And this is gonna be either a plus toward your better score or a minus. If you don't, then they are gonna take it as actually he doesn't know what he's doing, or he didn't do anything, he just put it in his resume or her resume. And it's always helpful to have somebody else read it. And that will be better if somebody is really English speaker or somebody has been here, know the system, to read your application or what you're gonna tell them. And it's accurate and it's reflective and it's convincing. And practice that. Do not memorize it, but practice it in a way that if you're telling a story, they want to listen to a story, not too long, so they don't tell you you're talkative or rank you as talkative, but at the same time concise, and you're able to tell your story in less than a minute. It's always the span of the interviewer is going to be 10 seconds. So you have the first 10 seconds where you're going to be able, best shot to give for that answer, and not to talk too long. The same thing they may ask you for, and I know our program, they ask about extracurricular activities. They want to know, what do you do when you're not in hospital or not studying? Do you have any hobbies? Do you have anything you enjoy? Do you volunteer? They want to see how your potential as a balanced physician. And be specific and concise. So if you have hobby, for example, you like to play sport, be specific what you like to do, not every single sport. Or you have certain kind of, you play certain music, instruments, tell them exactly what you do. You like to read, well, okay, what do you read? They are going to ask you, what did you read recently? So something like that. Be specific and honest. If you have nothing, I enjoy being with family and friends, that's okay. But at least you're not going to say, okay, I just sit in my room and watch TV. That's not going to be very exciting to them. And then be honest. That's very important. And sometimes, even if you have some sort of gaps in your application or weaknesses, you can convert them to strength. And American grads are actually very good in doing that. And they can switch that around. It's an honest answer, but they are explaining in a way that it's become a strength to them. They learn something from it, for example, or they took time for leave for their family, so their family are supported. Kids or husband or wife, or they took a test and that gave them better chance of getting better grades, so they have better chance in getting picked for strong programs. Something that they're gonna reflect and they are gonna be feeling good about it. Letter of recommendations. You already sent your letter of recommendations. Word of caution: the letter of recommendations, they read them, and they read probably the first line and the last line, the maximum. And these two lines have to be very strong at the beginning and the end to show that whoever writing their letter willing to take you in their programs. They know you. They know you well in whatever skills settings they have, like clinical skills or research skills. What is the exposure? Not because you're their friend. Avoid any conflict in your letters. Do not ask someone who's related to you to write your letter. Ask for someone who is actually known, who has the same specialty, at least one of them. Or you did a clerkship or observership, they are going to write you a strong letter. They can tell you that. Even if you waive your right to see the letter, doesn't mean that they're going to write you a weak letter. And do not ask them if they don't know you or you're doubting that. If you have a letter that you can add to your, or you want to take with you, you didn't add it to your application, take it, give it to the secretary. If it's really good letter, a strong letter, and it advance your application, that's okay. If you published an article, didn't come out by the time you send your application, and now it came out, this is the time you can add it when you go and prepare it before you go to interview, printed, a good printed copy, and give it to the secretary so they can, or have it with you in your application. When you meet the program director, I would like to share with you my recent article that just got published, added to my application. That's absolutely fine. So these are very important. And the chairman letter is very powerful if they are able to write a strong letter. Say, we're willing to take this person in our program. We recommend him highly without any reservation. So these are the buzzwords that they have to see. Prepare yourself for better interview. That's take a lot of effort before. So this is part of what you're doing right now. When we were in your shoes, there was nothing like this. So we had to do our own homework and to ask people up before us that they were successful in their application and they matched. So to learn those things and skills, and also it's all personal. So you need to be, you're representing yourself. You need to sell yourself. You know, you're honest, but you know what are the strengths that you're going to highlight in this 30 seconds that they're going to ask you, tell us about yourself. You just not pause, or this is not the time to be humble. You have to be strong, and you have to be in a very nice, polite way. Say, I'm so and so. I graduated from this school. I was top 10 in my class, or second in my class, first in my class, and this is why I'm applying for. I came to the United States. So you have to bring something personal about you and your goals. Then explain any gap in your training if you asked. So you do not need to bring that unless it becomes very important that you want to bring right away. Improve your communication. Be prepared. The communication is #1 reason why people will not be ranked. So you're invited. Once you're invited for interview, that means your credentials are acceptable to the program and you are within their margin of errors, that the range that we will accept in your credentials. Now, what's make you not on the ranking list is if you have poor communication skills. And this is why it takes time. You have to practice. You have to listen a lot to English speakers, so you're not saying, sorry, I didn't understand what you said. That's either you're not paying attention or you don't know. You're not good in English language. So this is very, very important. And you can practice with your friends as long as every day if you want, until you're getting this in a way that the people, they are going to feel it. You have good communication skills. There is you can ask other candidates for their experience if you know them in the same program. Every program, as I told you, have their own style of conducting interviews. And again, the mock interview will help you to do, but it's not going to be enough one time. So for the communication, prepare yourself for better interview, being familiar with the program. That's #2 reason why people will not be matched or ranked, is if you go to a program, you have not visited the website, you have not really read about the program. And if you went to their website is old, do not tell them that your website not good, or your website is not up to date. I couldn't find something. Be familiar with the program, the maximum you can do, and online, or you can call. You can even call the secretary if you have a question. How many spots do you take every year? What are the potential for your residents? And these are the questions you want probably to ask the program. If you visited the website, you couldn't find it, but don't tell them that I couldn't find it on the website. I have when they ask you have a question, that's the question you will ask them. But after you did your homework, and also if you're able to, for example, for sure you're gonna interview the program director. So the minimum you are gonna need to program and associate program director to know them. Who are they? What do they do? What's their interest? That's a very important. Know their names very well, so you can greet them accurately, stating their names. And write those questions, key questions that are relevant to, because it's not good when they ask you, do you have any questions? Say no. I mean, either you're not interested or you really didn't do your homework. Avoid unnecessary, I listed some of them here, questions that they are not relevant. They prepare yourself for a question that's commonly asked. How do you see yourself fit in this program? And you are gonna need to find that a sweet spot that say, okay, well, you're an international medical graduate. Why should you fit in that program? So you're gonna find that niche that you're gonna bring. So probably your best answer you're gonna find from previous candidate or previous residents that went through the same program, and you ask them what's strong about their program. Why do you like it? How can I be good? What do they look in candidates? And that's something also you're allowed to ask the program director. What do you look in an ideal candidate for your program? So and that will give you actually a good idea about their program. And these are this is a few things. I'm not going to go over them, but it's really clear. These are should be known to everyone. Be prepared and avoid any kind of distractive things that can really ruin your interview day. And read your itinerary carefully so you know who you're going to be meeting with. Memorize their names and the spelling of their names. If their names, some of them have really difficult names. So you can go to the secretary and say, okay, can you tell me how this Dr. So-and-so or the promoter would like to pronounce the name or say his name? How should I say it? That's okay, as long as you're prepared. Or the residents that you may know in that program. And these are things also before you're just leaving to your interview. Try to go, if you go on time, you're late. If you go on time to your interview, you're late. You should be there minimum 15 minutes before the time of your arrival. So if they say you should be here at 8, you are there at 7:45. And you know the area. You should go, if you don't know the area, you should be there even earlier. So you do not get lost and running there and now huffing and puffing, and that's not good, and sweating. Take with you, and that's a habit that American grads always do, that they take a small folder, business folder with them and a notebook. That's help you and show some dedication, important, and also it gives you, if you're gonna write something or a name or an email or take notes, it's right away you're gonna write it. Or if you have a question that came to your mind, you're gonna write it, then you can ask it. So that's always, don't use your phone or computer. That's not the time. Turn them off. It's not the time. Actually, leave them in the car if you want even. It's not the time to at all to pull them up. Now, when you arrive, you need to be slow and calm, and not like exaggerating smiles, laughing always, but not to be also looking upset looking or very serious, because they're gonna look at you from the day you enter the door of that hospital. Right away, identify a bathroom. So if you're under stress, and you do not want to be in the last minute, as I told you, turn off your cell phone, or even better, leave it in the car. And be professional. Everybody's watching you. And you never know. Maybe the program director will be walking across the hall from you when you're entering, and you're on your phone and you're speaking in Arabic. Don't do that. And that's not the time to greet your friends that you know from your program or from your school, and laugh with them. Be professional with them. That's the day that you're going to be very professional with everyone. Interview day also, as I told you, those are key elements. They should, you should know that, but I highlight the importance of good eye contact. If you are looking at the ground or the ceiling, that's a mistake that they're gonna point at when they score you. That your personality kind of is not well balanced, and even if they like you, that's not gonna be in your advantage. Good eye contact and a slow speech so they can understand you. And no leg crossing, be respectful, or covering mouth, or doing certain habits. Try to practice it as I told you. And to be spontaneous yourself, not memorizing answers, but speaking from your heart, but well prepared. And also, those are, I'm not going to repeat them. Be flexible, not restricted. So they ask you, what visa do you want? Oh, I want H1 visa. Well, they may not sponsor H1 visa. So you have to give that flexibility. Are you not starter with them? If they say, we do not sponsor H1 visa, you say, I'm not. Why would you waste your time? If you know that they are not, this program does not sponsor H1 visa, do not interview with them if this is very important to you. But with this difficulty in matching, probably you should be flexible. That's the smart way. At the end of the job interview, make sure you have some question ready and thank them for their time, and not to just walk away. These are top 10 questions that I picked from my experience with interviews. They commonly ask these questions. They may ask different questions, of course, but before I tell you that, you should probably, and maybe 10-15% of programs may ask you to tell them about a case, interesting case that you have experienced or saw during your they will be flexible with you, in your clerkship or rotation, or even during medical school, or you have done residency before. Tell them about the case, and they want to probe you. Do you have, for example, are you prepared? Do you have good sense of what is the case? How did you manage it? Do you have good medical knowledge? So it open up more questions to you. So be prepared with that case. And it doesn't have to be very complex case. It can be simple case. It can be PE case. It can be simple case, but it's interesting, and you learn something from it. And they are going to ask you, where did you find your answer for this question from this case? And that's where they're testing you now. Are you prepared for your day when you start your residency? Do you have, so remember, in your residency, they're not going to spoon feed you knowledge, but they will teach you how to go and learn and learn the rest of your life. So where to find and how to find the answer for your question. And that's very important, because if you do not know where to seek the answer, that's and don't tell them, okay, I'm gonna Google it. I'm gonna go to Google and find the answer. That's not a good answer. You have to be specific. You say Google Scholar, maybe that's more acceptable, because you're going to original research. But at your level, you don't expect you to go to PubMed or Google Scholar. They want you to go to a source that kind of pull everything together. You can have access to original data, but at the same time, it will give you concise. So Cochrane reviews, for example, up to date, are really good. Harrison textbook, it used to be our Bible for medical knowledge. So if we want to go and find something or read about something, we will go to that. Not anymore right now, because the knowledge is exploding and evidence is changing every day. So up to date will be a good start. Then you can go to more original sources like PubMed, Cochrane Review, and other resources. So the questions they may ask you, why did you do certain elective that you list on your application? And I still remember a candidate who did an elective of endocrine in North Dakota. And why would somebody go to North Dakota? He's from India, and he went to North Dakota to do endocrine rotation. And his answer was very, very good, actually, because in his town, he was from northern India. He's from the mountain, and there was a lot of, I think, hypothyroidism and the lack of iodine deficiency. So he was interested in endocrine, and he wanted his town, his village all of them were deficient, and they were struggling with this problem. And he wanted to go back to India, and he wanted to serve his community. So he wanted to specialize in endocrinology. And he found actually a program in North Dakota that has the same thing. There is a small area and that they have similar things. His answer, although I don't know if he was making up that answer, but everybody in the panel said, wow. And he matched. He was ranked highly and he matched. So you need to be very careful when you're giving that answer. And this is why you need to practice your answer about those, and you're very familiar with your application, whatever you send. Why did you do your research in cardiovascular medicine or this area? Not because I couldn't find any area of research. Maybe initially that was true, but why did you stay doing it then? You must have liked something about it. Why did you like it? Maybe something that you're passionate, you want to continue studying in the future, you want to specialize in this field. There's a certain story in your life that impacted you to be attracted to this field. You have to find the answer. Why did you choose this program? What's unique about it? That's another thing. And then you will, why did you choose, for example, Detroit? Detroit crime rate is high. I'm not going to say that why I chose this, because there's a lot of gunshot wounds here. Probably you're going to need to find what's unique about the Detroit program itself, that you're willing to come to Detroit for it. Or if there is really this town attracts you, there's family connections or friends here that you're going to be able to socialize with. But always you have to bring something unique about that area. Other questions, they come very commonly. Everybody will be asked, what's your goals? Where do you see yourself when you grow up, or in 5, 10 years? And you say, well, I don't know yet. That's kind of not, even if you don't know, you should have some preparation. Say, well, I need more time to look at other, I want to get exposure to other specialties. As of now, this is why I'm applying for internal medicine. I love internal medicine. If you really want to be a good internist, this is where you don't need to be specialized. Not everybody needs to be having some specialty. I love internal medicine. I want to practice as primary care. And a lot of internal medicine program, actually, they favor that, because there's shortage of primary care physicians, and they want to invest in those who want to pursue their career in primary care. And that's very, actually, attractive to them. But if you want to do specialty and you're honest, that's fine. But remember, if you're applying for a program, maybe community program, that they don't have fellowship, and you say, well, I want to do interventional cardiology. Well, say, well, we don't have fellowship in interventional cardiology, and it's very competitive. Where do you see yourself doing that? How you're going to prepare it? They are going to take that in consideration. They want you to be successful. So if they see, well, he doesn't have strong application to be interventional cardiology applicant, we don't want him to not have that chance. Maybe he doesn't fit in our program. He should probably go to a program that has fellowship. So that's important. You need to keep that in your mind. Do you enjoy doing, what do you enjoy doing in your free time? We discussed this before. Be specific. Why should we take you in our program? And again, that's bring back, how do you fit in that program? What's just the strength about you and the weaknesses? And you can convert your weaknesses to strength if you choose the right one. But never say, well, I don't have any weaknesses. That's not good. Or if you say, okay, have you ever done a mistake? I'm not sure if they're going to ask you to residence. We ask that for fellows, because they already did their residency. And we ask them, have you done a mistake? What did you learn about that from? Or have you witnessed a conflict between your resident and you disagree with your attending? What do you do? Or you saw you're attending ordering a medicine that you don't agree with, uh, what do you do? So they're going to ask you those behavioral questions, and you see how you're going to be able to handle potential conflict, or family members that they refuse, for example, full code or DNR, whatever so these are scenarios, and they're countless scenarios. So the more you think about them, the more you'll be prepared. There's a lot of other lists. I think I'm running out of time, but I'm gonna go over them and just so you can look at them. And if you have any question about any of these, you let me know, or let the moderator know. There is things you should never do. First of all, we discussed this: coming late, and be prepared for traffic. Look at your map or Google Map. See if there is rush hour, or you're going to busy town and living, and you took hotel far from the program, and you shouldn't do that, by the way. You should take a hotel very close to the program. But be prepared. Inappropriate attire. Be casual or informal. Never say hi sir, hi there. These should not. These are disrespectful. Don't give information about you that are not necessary. And start joking, and they may be very simple people that they're interviewing you, and sometimes they're super simple. They're trying to be more simple so they can probe you. Or the secretary start to joke with you and start laughing in the hallway. That's not good. Or talking very fast, and so they do not understand you. And then again, so do not interrupt the interviewer. Never interrupt the interviewer. Be a good listener. Let them finish, and then you'll be able to you will be able to answer the question. These are the things that I think I thought that it would be helpful to you, but again, it doesn't cover everything, and I'm sure there's going to be questions, so we'll leave some time for that. Thank you again for the opportunity, Dr. Muhammad. I will convert it back to you.
Thank you so much. Thank you so much, Dr. Abdulghani. It was a really excellent presentation. I really enjoyed it, and it's always interesting to know about those the don'ts. It's actually more important than the do's, especially if someone is making a mistake, or it's gonna ruin the whole day actually. And those are the things that we're trying to avoid most of the time. Jazakallah khair. Thank you so much. I will move to Dr. Tariq Youssef and with his presentation. And after the presentation of Dr. Tariq, inshallah, we will have about 35 minutes of questions and answers. I would like to ask everybody to write down their questions, and they can start from now if they want, or if they want to wait until this lecture from Dr. Tariq is done. Then after that we can receive questions. And I would like to ask Chicago, Detroit, and the Cleveland locations to prepare their questions and maybe write them down. So we're going to ask each location to give us their questions one by one. And if we don't have time to answer all the questions, then maybe we can post them on the Facebook page event, and we can answer them inshallah during the next week. Go ahead. So we have now Dr. Tariq Youssef. Dr. Tariq Youssef, of course, he is one of the SAM's Education Committee members. He graduated from University of Damascus in 2002. He did pathology residency at Damascus University, and then he did the internal medicine residency at Cook County. He then became the chief resident there in Cook County, and then he did cardiology fellowship and chief cardiology fellow at Cook County. And then after his fellowship, he did another fellowship in interventional cardiology at University of Nebraska and Iowa Heart Institution. He's currently now practicing in North Chicago. He's board certified in medicine, cardiology, echo, nuclear cardiology, interventional cardiology, and of course, he is one of the active and uh, one of the active members of the education committee at SAMS, and he's the one actually who's conducting the journal club since the last month, and he always available for help. Thank you so much, Dr. Tariq, for your contribution and for the lecture today. And go ahead. I can't hear you. I can't hear anything.
Can you hear me?
Yeah, I can hear you now. Yeah.
All right, Assalamu alaikum jami'an. Thank you, Dr. Muhammad, for the introduction. Just for للأمانة يعني العلمية الفضل بالجورنال كلاب الحقيقة بيرجع للدكتور أحمد مجاهد, who's the front runner on this thing. I'm just helping out with the project, but it's all his production. Can you see my screen?
Yes, I can.
All right, very good. So this is, I think, a very important topic that we started to do regularly for the past few years because it is an area where we definitely can improve. I'm going to try actually to do something which is not easy to do online, but let's give it a try. And I want you to think of a role model doctor that you met in your life, somebody who you look up to, somebody who you met, he taught you, he took care of one of your relatives, etc., etc. Think about that doctor, he or she, and I want you to summarize in your mind just one thing that you think put that doctor at the top of your mind. Something that you think I'm just trying to fix the sound here. Hello? Is this better? The voice?
Yes, this is so much better. No noise. Yeah.
Are very nice. So think about one thing that you think makes that doctor stand out as a role model. Keep it in your mind. We're not going to be able to do this, I guess, to show you that this really works. But I'll tell you actually what I do when I was a chief resident, a teaching fellow, during my teaching, attending sessions with people. I always ask this question actually to residents, to students, and I ask them to write down what is that one thing that made that doctor stand out in their minds, and why did they look up to it. I'll tell you what the answer is not going to be. The answer is not going to be, oh, because he knows too much. He's very, very, very good at bringing up information. He's very up to date. He knows everything. That is never the answer, almost never. In 90% of the cases, the answer is going to be within the scope of professionalism, within that scope. In 90% of the times, at least from the previous experiences that I've done with students, with residents, with fellows, with actually even colleagues and stuff. The answer is almost universally going to be something like, oh, he's very polite. He really cares about patients. He really is an advocate for patients. He really, I feel like I'm safe in his hands. He cares about me. He spends time to explain things to me in a perfect way. I understand what he's talking about, etc., etc. He's very kind. He's very nice. The 10% left, actually, again, is not about knowledge. And most of those 10% that are left out of professionalism, it comes into one thing, which is, oh, he knows how to make complicated things so simple in most of the cases. That brings us actually to our topic today. Medical professionalism is the heart and soul of medicine. That is a fact that you need to keep in mind. Your interview day, most of the focus is going to be on parts of the professionalism aspects, whether it's in your skills, whether it's in your behavior, whether it's in your knowledge. This will be discussed, as we said, throughout the time, throughout your time as a physician. Professionalism is something that's going to come again and again during your interviews, during your training in residency, during your job interviews, etc., etc. Showing a good character as an applicant can make you more likely to be accepted to a residency, as the admissions committee will believe that you can only improve, and they will help you to improve during your residency if you're accepted. On the other hand, it is considered very, very risky from the program perspective to accept an applicant who appears lacking in professionalism. They might take chances and take somebody whose scores are not great because they could bet that this guy actually, his scores do not reflect how good he is. He was very good. He did a lot of research. I mean, they can take that risk, no doubt. What they cannot take the risk of is taking somebody who does not care, who's not professional, who might insult other people, who might come across as a problem maker. There are many ways you can demonstrate your professionalism as an applicant. And I'm talking now a few things before your interview day. This is all before your interview day. If you're out of town, please arrive the night before the interview and stay in a hotel. Know the way to the place where you're going to be interviewing, so you don't come late the next day. Be familiar with the program. It is unprofessional that you're going to interview in a program that you don't know nothing about. You've not read about the program, you didn't have any friends, you did not talk to anybody about the program, and when you go there and you're trying to convince them that, oh, you guys are the best, I love this place, and they will, and you give a whole bunch of reasons why you would, like, you think, I mean, by generic reasons, something like, oh, I love this place and stuff, and then when they ask you about specifics, they find that you know nothing about the program. That's unprofessional. That means you're lying about why you want to come to the program. For emails, make a point that you only email people to whom your message actually pertains. Do not send mass or chain letters. Do not do CCs and BCCs to people. If you want to send somebody an email, send him or her the email. If you need to send the same email to somebody else, just do it as a separate email. Make a point to respond to your messages promptly, and that means within 24 hours. Now, that's sometimes impossible. When somebody sends you an interview, you can be actually interviewing somewhere else, and you're on the way to travel, and it's going to take you 2 days before you come back. You want to look at your schedule before you finalize which day you want to interview in the second program, etc., etc. Those are all good excuses for not kind of responding with a detailed email about it. But you know what? What you can do is you can send a few lines thanking them at least for the opportunity and telling them, and this is considered very professional, telling them that you're on your way to interview in another program, or you're on a travel or something, and you will get back to them within 48 or 72 hours with the final date of your planned interview. Always use spell check and grammar check before sending messages. This is as simple as it sounds. I personally know actually an associate program director who turns off any application of a candidate who does not do spell checking. The way, I mean, this is probably a little extreme, but it is a fact that there are people who are very sensitive into this matter. They think that if you're really serious about your application in this program, about your email, about your personal statement, etc., etc., you would have spent 2 more minutes to read what you've written down and make sure that there are no mistakes. Those 2 minutes are very valuable. And then As a general advice, I would recommend actually that you include good contact information, including your telephone number at the end of your message or email. That helps the program to contact you in cases of emergencies, rescheduling, etc., etc. You only get one first impression when you meet somebody, and that first visual impression is incredibly important. It does not, as it not only lasts, but can skew any further impressions that you make later on. That impression could be formed by how you appear, how you behave, and how you communicate. And we'll talk about those three things in details. During the interview, you definitely need to arrive early for your interview. As simple as it sounds, as I said, the surgeons never roll half an hour late into the operating room. That interview that day is as important as going for a surgery as a surgical resident, as important as rounding on patients when you're an internal medicine resident. That interview that day is the most important thing in your life that day. So be serious about it and take it very, very, very seriously. If you need to change, cancel an interview day, it should be done as early as possible so that another applicant might be contacted by the program. Now, I want to tell you how people perceive this and how they think it from the program perspective. They look at it as, oh, this guy is a team player. He knows that if he loses the chance, somebody else needs to take that chance. It is a process. He's not selfish. It's not that he does not care. It's not that he really thinks about others. He knows that there are other applicants who, now that might not affect you personally, but you know what? If 1 or 2 or 3 Syrians do this on a regular basis, it starts to build up as a culture, as an impression that is formed about a country, a place of as an impression that forms about a place from this earth. In general, countries do have, or applicants from certain countries do have general kind of give general impressions in the programs. The Syrians so far have been very successful in proving that they are, for example, very hardworking. I hope that we can create something similar in professionalism. And I'm going to talk about this, our job and our duty to do this in probably the last slide, as a group, what we should prepare to do. Sometimes you are watched whether you're sitting at lunch or participating in a group discussion. That day of interview, you are under the microscope, especially if the people who are being interviewed are not many. If you're interviewing in a program which is interviewing like 20, 25 candidates, it might not be as serious. But if there are only 3, 4, 5 people who are interviewing that day, each one of those are going to be actually under the microscope. They're going to be watched for even the small details. Appearance on the day of your interview. Dress professionally, and I'm going to actually show you slides about what is accepted. My advice to you is smile, smile, and smile. In some parts of the world, professionalism means you should not be smiling at all. This is serious business. That actually is valid in many of the European countries. In America, it is different. Smiling talks about how kind you are, reflects actually some confidence. People are expecting you to smile. So again, smile as much as you can, not into a pathologic way, obviously. But if you look at somebody and that somebody is smiling, just go ahead and smile to them. Try to look as nice as possible. You have to have good eye contact. I think most of you now understand how important that is in the American culture. A firm handshake is very important. We'll talk about this in a little detail in a minute. The way you sit is very important. Sit up straight, maintain professional body language. Do not move or sit in a lazy, drooping way. Do not bite your nails. Do not pick at your skin or outfit constantly. Handshakes. You have 30 seconds to make a first impression, as we talked about. A good handshake, as they say, is worth 1,000 words. What is a good handshake? Make a good first impression with a firm handshake, 3 to 5 seconds, no wimpy handshakes, the entire hand, web to web, shake lightly, and then release. Always stand for a handshake. If you're interviewing somebody and another interviewer comes from outside, interrupts for one reason or the other, or the coordinator gets in and tries to shake your hand, please do not keep sitting down. Stand up and shake the hands. Never shake a hand again while you're sitting. Never have your left hand in a trouser pocket while you're shaking hands. Try to remember people's names. That's very important. Every now and then, if you can call them when you answer their questions and stuff, you can call them by Dr., let's say, whatever, Sankari, Al-Yusuf. That actually improves the communication between the two of you. And introduce yourself. Now, when you introduce yourself, we'll talk about, actually, I think I do have a slide about this. Now, let me bring a specific topic that pertains to the Syrian people about handshake. In the previous years, we've always been asked this question. I don't handshake with a cross gender. Is that a problem? Well, we used to give some personal impressions about this, anecdotal evidence. We tried to take this question this year into a little more kind of evidence-based approach as much as we can. So we asked this question on probably the largest Syrian doctor group in America. We asked them, do you have an objective evidence that refusing to shake hands with a cross-gender affects somebody's chances in matching? And those are the choices. Not sure, but I feel it might decrease the chances, or definitely no, it does not, or definitely yes. And here are the results on the right. It might decrease your chances, 53% about. No negative effect, 39.5%, so that there's no negative effect. And 7% said that it definitely decreases your chances. So if you actually look at it as like either yes or no kind of thing, you're going to see that about 60% or so think that it's going to decrease your chances, and about 40% or so do not think that should affect your chances. You can draw your own conclusions. You can kind of think about this for yourself. We're just presenting you the data as is. Behavior during the interview. Extend common courtesy. Be polite in attitude and behavior to everybody. Do not say any bad things about any school. Do not say any bad things about any program. Do not say any bad things about any subspecialty or people you interacted with. Now, do not tell lots of jokes or use sarcasm. Remember that those people are meeting you for the first time, and they might not get your joke or your sarcasm. To try to do that. Do not talk about controversial issues. Obviously, the thing that pertains the most into our situation is the situation in Syria, the politics. If they ask you any things that are controversial about what do you think, who should do this, who should do that, I would advise that you avoid in a nice way, in a smart way, get into the details of things. Say stuff that everybody agrees on. Things like, like civilians should not be targeted by anybody. We should create like safe areas for those, etc., etc. You get the idea. You should be very careful not to exaggerate. Give an honest and accurate response to every question that is asked. The people from University of Damascus should not say, oh, I'm from University of Damascus, this is the best hospital, the best university because guess what? Aleppo people are saying the exact same thing. Kalamoun in the past few years have been saying the exact same thing. And it becomes so confusing, and it makes us lose credibility when we talk about our universities. Take responsibility for your behavior, whether it's success or failure. If you failed, if you flunked one of the tests, if you did not score high, take responsibility. Do not blame fate. Do not blame circumstances. Try to take responsibility. Show that this was that you identified the mistake. You try to kind of work on it and improve on it, and it does not reflect who you are. You can allude into the circumstances, but do not blame the circumstances. If a beverage is offered, decline politely. I'm talking about during the interview. Outside the interview, you can eat, drink, whatever you want to do in the lounge. But during the interview, if somebody offers you a beverage, my recommendation would be to decline politely. Respect is a key word during those interviews. Be nice and respectful to everybody, whether it's a coordinator, whether it's somebody who's cleaning the house, the rooms, everybody. Thank any members of the staff or management who took the time to talk to you during the interview. Do not chew gum. This is a common mistake. Many people actually forget. They don't mean it, but it is considered very unprofessional. Make sure that you turn off your cell phone. And unfortunately, I've seen cases where people forget, and in case it rings, you should have a cliche that you say. Something like, I'm so sorry, I was so caught up in preparing for my interview that I forgot to turn it off. If it does happen, you need to understand that many people think that you will have to be the absolute top candidate for the position in order for the embarrassing act not to knock you out of the race. Do not cross your legs when you're sitting down. Do not place personal items on the table. No cell phones, no handbags, no briefcases, no water bottles or coffee cups, obviously. Communication. Avoid using the first names. Be professional. Doctor and the last name. Never introduce yourself by the title. Don't say, oh, my name is Dr. Al Youssef, or my name is Dr. Tariq Al Youssef. No. My name is Tariq Al Youssef. Nice to meet you. Practice introducing yourself. Have a cliche, a 1-minute commercial about yourself and your goals that you will tell potential employers. Speak clearly and firmly. And as said by Dr. Sankari, that you probably should actually try to slow down, because that reflects confidence and it makes people understand and not kind of get used to your accent and everything. Follow the interviewer's lead on the topics. If they want to discuss something, kind of keep in that topic as much as you can, as far as you feel comfortable discussing it. Do not jump from one topic to the other. If the interviewer wants to talk about your research and you know that this is a strength point, don't try to say, oh, don't jump to another thing without like kind of roughly. The transition has to be smooth between the topics. Be smart about what language you speak with the interviewer. Sometimes you are faced with Arabic people, let's say Egyptians, Jordanians, even Syrians, who you know they are Arabic from their names or from somebody who told you that they are Arabic speakers. Do not, never start an Arabic conversation with them unless they do. If they do ask you a question in Arabic, answer in Arabic. If they ask you a question in English, answer in English. Listen carefully and learn. Do not interrupt, as Dr. Sankari said. Do not interrupt the interviewer. Do not initiate discussion about salary or benefits. This is very important. Fortunately, we as Syrians actually do not do that much. Never turn down an offered business card. This is a mistake that I've seen happening, unfortunately. If somebody gives you a business card, don't say, oh, thank you, they already gave me one, or I did get one outside, or no, take it and make a point of looking at it. Look at what is written on the information there, the name, the email, whatever. So that refreshes your memory about what the name of the interviewer is, so you can kind of on your way out you say, thank you, Dr. So-and-so, for your time or whatsoever. Thank the interviewer, as I said, and send a handwritten if possible. This is not an email if you can, and not a handwritten follow-up thank you note. Email would actually do okay, especially in the past few years, but a handwritten reflects usually that the people, like, that you're more serious about it. You spend the time actually to write it with your hands. It's very personalized. You send it to the person who interviewed you by mail, etc. Now, dressing, as we talked about for the interview. Dress for the job that you want, but try not to be different. Don't be somebody who chooses like a weird color of the suit or something like that. I mean, again, fortunately, we as Syrians are good dressers in general. I don't think it's going to be a big issue for us. But if you have any doubts, ask more senior people who you know, or ask even the SAMS members. I mean, feel free to contact any of us to give you an idea of, oh, what should I wear, or what color is accepted, or what. If you lack experience about this kind of issues, contact somebody who's senior who can give you a guidance. If there is a special event the night before, some programs send you a notification that there is a dinner the night before. It is okay to ask what to wear. Is it casual? Is it, if not already mentioned in the email? Usually those are mentioned already in the emails, that this is going to be a casual thing. You can come the way you want to look. Now here are, I mean, on the left is like details about how a woman can dress, what is accepted, what is not in details. But on the right, the pictures actually kind of summarizes what 90% of the people would do. These are the two accepted models in general for a professional interview: either a skirt with like a jacket and a blouse, dark colors, nice shoes, polished, etc. For men, it is the exact same thing. I mean, it has to be like a suit with a necktie and like a clean shirt. Now, do not wear any of those things. Now, again, this is completely unacceptable. High heels, it's going to affect how much you do, how fast you walk, or how you walk during tours and stuff. Long nails are kind of unacceptable. Long hair in general. If you have a beard, just make sure that the beard is you're well groomed. It's nicely cut. Avoid tattoos. And the common mistake that we might do actually is, because we're from a little different here, they don't like overpowering cologne or perfumes. If you can try to avoid that, because it can actually induce a lot of like coughing, and people sometimes don't like it in general. If you want to put something, make it very, very, very light. All right, again, another question that we get asked almost on a yearly basis: how does hijab affect your chances in matching? So we asked the exact same group to vote on this question. Do you have an objective evidence that hijab affected someone's chances in matching? 72.5% said no. 22.5% said it possibly affects your chances negatively, and 5% said possibly affects your chances positively. Again, this is raw data. You draw your own conclusion. Think about it and draw your own conclusion about it. I'll give you actually some thoughts that those people who voted on this question, what their general thoughts about these things, and these are scattered, like collective from different people's opinions. It says it might affect matching in some programs, on the other help in some other programs. The specialty and the city plays a role in this. They are factors that affect the question. Focus on the most important factors that really affect the matching for everyone. So they think for the most part that there are much more important factors than like the hijab. If you're wearing a hijab, you should be aware that your medical training journey will not be easy, especially during these hard times. Of course, this depends on which part of the country you end up matching to. There's a general consensus that, in general, though, really actually respects you for who you are. Now, this is my last slide here, and this is not talking to individuals. This is talking to you guys to us as Syrians. our responsibility these days is even more. We're going through very difficult times. It is easy to be selfish with everything happening. It is easy to lie. It's easy to complain about bad luck, and it's easy to blame others. But I think we really need to stand all together and make a point of building up a reputation as Syrian applicants. And the easiest way of doing that is by being professional. As I said, in the past, we were successful in showing that Syrians are really hardworking. I think it is time to show a lot of professionalism. So we kind of implant a seed that you're probably not gonna kind of get the results of this year, but what you implant now is going to actually show off in the next few years for the future candidates in the United States. What you guys are going through today, a part of it at least, is what people did a couple of years ago. Think of how your behavior would affect any other Syrian. We are under the microscope these days. I do have faith and hope in one of the oldest civilizations on Earth. So I do have a lot of faith in you guys in building up a new, good, better actually, reputation for the Syrians. And I think we're capable of doing this. It all starts on the individual basis, but as I said, we should start to think as a group about the future of the Syrians matching in this country. So I'll stop here and I will be happy to take any questions.
Thank you so much, Dr. Tariq, for this presentation. It was wonderful, and it actually answered a lot of questions that people may have. I would like to start with the questions and answers. I know that we are late, like half an hour late, but I will give 30 minutes to answer the questions. I would like to ask Dr. Abdulghani, if he's still with us, to unmute himself and maybe answer any questions if needed. So, questions and answers. I would like to start from our locations. So far, I have questions from Detroit. I don't have questions yet from Cleveland or from Chicago. So let's start with Detroit until Chicago and Cleveland send me their questions. So the first question is, what's the main difference in questions for community versus university programs? Dr. Sankari?
So if I understood this correctly, what question about their program? So what questions should they use when they're asked if they have any question?
Well, I mean, I'm trying to understand the question, but I can't. I mean, I don't like to assume, but I would like to assume that the main difference, like when you ask the program, when you ask community or university program, how would you ask them as an applicant?
For questions. So if they said, do you have any other question? So if that's what's meant, for community hospital, again, you need to be familiar. So there is community hospitals that are really large and they have a strong history of teaching, and so it depends on the program. If it's a program, it's a non-university program, they first of all you want to know that if they have certain, if you're looking for fellowship, for example, and they have fellowship, so you should know that. But if you want to ask them a question and they don't have specialty for this, do they allow, for example, certain rotation? Like if you want extra rotation, you want to do cardiology, and you want to do a extra rotation in cardiology, is it allowed? What year? You can ask them if you want, for example, for the university program, how can they strengthen their application for fellowship in the future if they are interested in certain specialty? This is a difficult question. I cannot give them an answer for it's a vague question, but it depends on the program itself. cannot be just categorized university versus community. But majority of university have fellowship, majority, and majority of community hospitals do not have fellowship. So that would be one focus. Or, for example, population. In residency, if it's community rural hospital, they may not see as much of certain urban disease. Like they, for example, they don't see a lot of um, toxicology, or they don't see a lot of drug abuse cases. The exposure to patient pathology could be another question they can ask. Um, and they can ask about what are the training skills. I told you actually one question. What do they look? What is their ideal candidate? What do they look for in their ideal residency candidate? And that, I think, fair. Is there a research opportunity for if you're interested in doing fellowship, particularly in university, mentorship and opportunity in research? Because that's going to be very important for their fellowship. There's a particular clinics that they can join or community clinic that they can do with certain mentorship. Yeah, so I hope I answered
Yeah,
that
that's
question.
excellent. Jazakallah khair. What's a good excuse for a second attempt in one of the USMLE exams? I think this is one of the common questions. Tariq, do you have an answer for that?
I don't have an answer, to be honest with you, because that's that's a question that should be very, very personalized in the way you answer it. My recommendation would be general guidelines. The guidelines, as I said, is you have to show, this is the general thought process in the program director or like the whoever is interviewing you. They want to hear the following, that you take responsibility. You are a responsible guy for a failure. This is considered one way or the other a failure. You take responsibility for it. There are parts of it that might not be under your scope, but a part of it is definitely something that you can do something about. You thought about it, you showed where the weakness was, you worked on it, and you fixed it, and you continue to improve in what caused that thing to happen. Meaning, when they answer, let's say I'm somebody who comes in despite the fact that I have a lot of bad, I mean, my scores are very high in my like transcript. I was ranked #1 in my medical school, etc., etc. But English was not my native language, so I come from a different culture. That was a challenge for me initially when I came here and I took the exam. I thought that is going to be one of those exams that I flew through. Because I thought that it is, let's say, similar to my culture, the way my patients sound like, and I kind of underestimated how different the culture was. And when I looked at my results, I identified where the weaknesses are. I joined, let's say, a course or like something that helped me to improve my language. I kind of tried to blend into the culture. I went to shopping malls and talked to people and involved in social activities to improve my social and communication skills and stuff. And all these things with a lot of hard work and a lot of effort, trying to digest a new culture and kind of blend into it in a very short period of time, allowed me to pass the second attempt easily without any issues. And I'm still working or doing this or that to being involved in social activities more, being involved in patients. I'm trying to do observerships so I can stay in touch with the patients and with the community, etc. I mean, so you have to show that you identified where the problem was and you moved it into a kind of a strength, something that you learned from. It's a mistake or it's a failure you learned from, and it made you a better person, not a destroyed guy. Like, it made you better, not destroyed. That's what they want to hear, basically. And then it depends on what your excuses are, or whatever. It all depends on your imagination or reality. Like some people do have some real excuses for this. It's something that is completely out of their control. But my roadmap for you, as I said, you should show your potential as a physician. That it's not about being a bad physician. You have to show that, despite the fact that I was so good and everybody was thinking that I'm going to pass this in a blink of an eye, and etc., etc. You show where the problem was, and you show that you worked on the problem. That would be my roadmap for you.
Thank you for the answer. Can I ask both of you, Tariq and Dr. Sankari, if both of you can maybe give us like brief answers, because we have tons of questions, and I know that those questions are very difficult, and these are very common questions that we always get like every year. So next question, Dr. Sankari, when in the interview asks. When they ask them, where did you interview or where did you get interviews from, what is he or she looking for, and what's a good answer?
So I'm glad that brought up. Actually, this year ECFMG does not allow any program to ask candidates for if they interviewed in other places. What program did they interview with? So that should not be asked. If they get asked, they have one of two options, and they need to decide on that themselves, because it is not right now legal to ask that question. So they have the right to say, to apologize and say, I would like to keep that. I would not like to share that right now. Or if they want to say very generically, I interviewed, for example, just recently in this program, but they do not have the right to ask them that question.
Okay. Next question is, what is the best answer for a question? Is it your first time applying for residency? Dr. Tariq?
Best answer is to be honest. Just answer, give the truth, basically. You cannot lie.
How do we respond? How to respond to questions about the situation in Syria, Dr. Sankari?
As I think that year, 2 years ago, that was start to be asked that question. Be as much as possible avoid going into politics. Everybody understand the humanitarian disaster that's happening and sympathize with it. And there are certain individuals, and I will say minority, they would like to probe you or challenge you. Do you agree with Assad what he's doing, or who would you like to do to run the country? What's your views about this? So try to navigate through and shift them away from that. Either you could try politely to apologize from getting involved in politics if they ask you a very specific political question, or try to say, okay, I'm stand with the civilian protection of civilians and to provide medical relief to the men and women and children that they are targeted. So try to avoid more than that and be very brief, and so they know that this is not something you want to continue discussing.
Another question, it says, can I ask the interviewer personal questions like their research, their hobbies, and even if those research have been already published online? What do you think, Dr. Tariq?
Yes, absolutely. Research, yes. Hobbies, no.
Okay. So I would like to move on to a different location. I will start with the questions from Chicago. We got some of them. So first question, how to answer questions about healthcare systems in US and challenges that the specialty face, the future of the specialty. Dr. Sankari?
I think it's very premature to ask this question, given that it's still not there is no experience for that candidate yet in the healthcare system. I would avoid that question.
Another question, it says, teach me something non-medical in 5 minutes. I'm not sure what does that mean. What is the question? I don't understand. Chicago, do you wanna, Hussam? I mean, I don't understand those questions. And then the third question, it says, tell me a joke. I mean, I'm not sure. What do you mean about that? Can you please send me another questions that's
هاي
more
شباب
clear?
يسأل السؤال بطريقة.
عفوا؟
بتحب حدا من الشباب يعني اللي سأل السؤال يسأله بطريقته يوضح شو قصده بالسؤال؟
يا لأنه ما عم بفهم شو هذا، يعني إنه بعتيلي هاي ما فهمتها يعني صراحة. إذا حدا ممكن يوضح لي شو هذا teach me something non-medical. What is that? What does that mean?
Like I want to know about sample answers for such a question if we get asked. Sometimes they ask to teach us something in non-medical in 5 minutes. So what can we answer for such a question? Like suggestions for it.
So my understanding is this is one of the questions that interviewers may ask. I don't know, Dr. Tariq, you have an answer for
Yeah,
that?
I don't think actually that's a. I think that if this question was asked, it's an extremely rare question. My recommendation would be actually to do this in the mock interviews. We can give samples of those in the different centers. Yes.
Okay. Another question says how. I'm sorry, I'm trying to understand the questions, but I can't. Do you recommend to show up at a program you are interested in without invitation, to drop your resume and show your interest? Do you recommend doing that, Dr. Sankari?
I don't, because they're really busy, especially in this season. They may, if you want to drop your resume, you can email it. Actually, you don't have to go physically, and so I don't see a reason to do that.
Okay. I just want to ask Chicago location if they want to just ask me the questions again or send another questions. And Cleveland as well, I would like to receive questions from Cleveland. I'll go to a different question.
No, we can some questions, Muhammad, if you have time.
Okay, I mean, I actually I didn't understand what do you guys mean by these questions? Do you wanna just ask him quickly?
Yes, sure. So this question says, if you are asked in an interview, how many interviews did you get so far? This is your first interview. How do you respond to this question?
I think we just answered that question already, right? Talking about other interviews, and this is illegal, not anymore.
Okay.
Yeah, another question?
So the third question is, how effective is it to send emails to the program to express your interest?
Okay, Dr. Sankari?
To be honest with you, it does have some weight, but it's not very effective, because most of the decisions is done right after the panels finish interviewing that individual. They will finish their score, or the maximum at the end of the day, and then they will rank on a separate day close to the day of the match. Sending the emails, it may ring in their head that about your name, so it's not gonna harm if you do it the right way, but it's not gonna. Don't put a lot of emphasis on it to increase your chance of matching.
I mean, I agree with Dr. Sankari about this. I mean, from my personal experience, I did that. I sent emails like to 40, 50 programs that they did not send me a rejection yet. And I did that mid-November. And then eventually, actually, I got 2 interviews within in that week. So I'm not sure if that was because of the emails I sent or because it was the time that they sent those interviews, but I can tell like from 40, 50 emails, I get 2 interviews more but I'm not sure how effective it is. Other people, they did the same thing and they got nothing. The same time, like
so if I want to, sorry, I misunderstood this question also. Is it that they're asking that sending email before they get the interview or after they get the interview?
I think my understanding is that if they send an email before they get an interview, so they ask for an interview.
Okay, so there's scenario that it will benefit. That's why I can interrupt.
Okay.
There is one scenario that can very helpful if there is a couple applying for the same match. So a man and a woman applying for the same. They're married and they are engaged and they want to match in the same program. This is very legitimate. If one of them got interview, the second person to share that with the program director and say, can I get another interview? Or the person who got invited can ask for that. My husband or my wife applied to this program, can they get an interview? That's fine. The other one, it can be helpful with email. If you have worked in the same program for a different department, and you have a letter or somebody who knows you and you work with him and he knows the program, it's legitimate to send them an email if they can do that comfortably for you. So that may increase your chance of getting an interview. But send it by yourself. I don't think it will be very fruitful to send multiple emails to the program. They may actually get annoyed. One time email to the secretary wouldn't harm. That's fine.
Chicago, any more questions? Otherwise, I would move to Cleveland.
One last question. How do you answer the question if you did not match? If you don't match, what will you do?
Tariq?
Yeah, again, I think this is something that we're going to do in mock interviews. I think we should save.
Okay. So I would like to go to questions from Cleveland. I got only, I think, 2 questions from them, from Nasser. I got 2 of them so far. One question says, I have applied recently for TPS for the first time and have not received my EAD yet. What should I say about TPS and what should not? Well, it's when you apply in the first time, you're applying and you're saying that I have EAD, but you don't have it. That actually, I think it's a problem. I think that you should not even do that. I think if you don't have the EAD in your hand, I think you should not do that. You should just say I want J1 or H1 visa, and that's it. However, you're taking the risk because some programs, they may ask you questions about the EAD, and then they will ask you, can you send us a copy of it? And then if you don't have it, then I'm not sure if they will rank you. It's a very difficult situation. I know that sometimes it get delayed, sometimes, but still, nobody can guarantee you. And I don't think that if they are aware of the EAD and if they know what is this, I would like. I think the best thing is to say I have an employment authorization document, but try to avoid TPS. Just say I have an EAD already. If you have it. If you don't have it, I would not recommend that you say I have it, but in the fact that you don't. Again, always be honest, especially when you apply. If you have, I think that's how it should be. Do you have any comments about that, Tariq? Do you know anything else about this or?
Yeah, I'm not sure actually. This is something that I think, again, being honest, I mean, I cannot emphasize enough how important it is to be honest about those things or anything. Do not lie, please. Do not, don't take your chances because you're not going to just screw yourself. You're going to screw everybody else who's on TPS. What you guys need to understand is these, for the most part, with very few exceptions, the program directors or people who you interview know about TPS as much as I know about quantum physics. They don't understand it. They think it's a problem. Actually, if anything, it's going to create problems for you if you go to the details of it. Oh, this is given for Syrian people who are... They think it is, especially with this mess that is happening now against the Syrian immigrants. So I would definitely not mess up that more than what's already more than the damage that's already done. If you need a visa, just say I need a visa, and then if later on you get your TPS, you can just say, oh, I don't need it anymore. Just drop it all the way.
Yeah, I kind of agree with Tariq. I think this approach is beneficial, especially if you don't have the TPS and the EAD already. Another question from Cleveland: when we are interviewing at community hospital, can we mention that we are interested in fellowships, or it is better to say that we are interested in primary care field? I think we answered slightly this question. If the program has the fellowship that you want, like let's say they have cardiology fellowship, then yeah, and you're interested in cardiology, then I think that will be good. That will be beneficial. However, if you are interested in GI and they don't have GI, and you say, oh, I'm interested in GI, then of course their answer will say, oh, we don't have GI. We're sorry. I think that's what they. When you go to a community hospital and they have only internal medicine and they don't have fellowships, I mean, personally, I think you should say, I would like to be a primary care or a hospitalist, or I want to open a clinic or an office. That's fine. Try, especially if it's a small program, try to avoid saying, oh, I want to go to cardiology fellowship or GI, because they will think each program would like to satisfy their own residents. They want them to achieve what they want. Like let's say they have 20 residents. They want everybody get what they want. And if they are not able to help you to get the cardiology fellowship, they will say, why would I take this person whose dream is to become a cardiologist, but we are not able to offer him or offer her this thing. We can't help them with recommendations. We can't help them with connections. So why should I take that person? So no, I would like to take someone who's going to be satisfied with the program, and the program will be satisfied with their achievements. So I would take it in that way. Um, I would like to take some questions from the online webinar people. One of them said, "Do I avoid fragrances in the interview?" I think we mentioned that light or no odors will be a good thing. Another question: how to address failure in one of the steps? We answered that question. Dr. Sankari, they asked you a question. They said, you mentioned the story of the Indian student mentioning that he did endocrine elective to serve his community. My question is it okay to say that I want to do residency to go back home and serve my community? Does this turn them off? Especially they have high demand for internists and they want to train people who are willing to stay in the United States?
Um, Not necessarily. It depends actually on the program. There is no one way or another. So some programs, it's personal feeling, some of them. They don't want to retain necessarily all their, and they know that. So, but it's individual basis. That individual candidate got high score because he appealed to us that he was thinking about what he's doing, not depending on chance or making up answers. That was the purpose of that example. So if they want, and if they're honest about it, that they truly say that they want to get their training here so they can go back and help their community, absolutely. If they're genuine about it, that shouldn't be against them, and we shouldn't lie.
Mumtaz. Another question to Dr. Tariq. They say, how do we explain the change from pathology residency to internal medicine residency during the interview? I think that they are referring to maybe your situation when you did your residency in Syria and then you're coming to the state applying for internal medicine. This is a very common question, and then I think many people will benefit from your answer, Dr. Tariq.
Yeah, I think actually that's true. It's true that you have to prepare a good answer. The way I was thinking about it is, I was making a case for a very good experience in reading smears and bone marrow biopsies and how that actually made me think about joining medicine and probably later on doing something in between medicine and like some research plus some clinical duties, or in the future, this was my plan, to join hematology oncology. which is going to be a big plus on my side because I already now I'm very experienced in reading smears and biopsies, familiar with the different types of lymphomas, and I know how it looks like under the microscope, what stains to use, all these difficult things in hematology I already have in hand. So that's the case that I made.
Thank you. Another question, it says, what's the best way to explain 3 unsuccessful attempts in CS? I think we already answered that question. What to say about failure in USMLE exams? Another question: how do we answer? Where else are you applying? How many interviews? I think we answered this. Um, Another good question: what to talk about when we are asked about our weaknesses, Dr. Sankari? And with
Yes,
examples, please.
example. So this is again, examples is going to be varying from individual to another. So the weaknesses, for example, if they you don't want to show that you are somebody who that weak cannot be corrected. So that weakness, for example, if they say I'm very emotional, and I cannot stand somebody, for example, having cardiac arrest, I will collapse. Um, that's not going to work. Or if they're very emotional, they start crying in front of patients. So this is something you do not want to show or you do not want to tell, and you need to overcome it. So you're used to those stressful situations when you practice. What you can do is actually say, um, I'm a dedicated person, so sometimes that take away time from other things that I want to do, for example. So if you're delegated a task, you take it all the way, and that sometimes if you don't pay attention, that take a lot of time from you, from other things. So you want to, and a lot of times, so you start paying attention to balance between those. So you want to be on task, but at the same time, you don't want to overbalance it with different tasks. You want to be focused, but you do not want to be fixated. So this is another weakness, that people get fixated, and then they stop hearing anything around. So they're reviewing medical record for a patient and sitting, and there's code blue running, and he is focusing on that. So that shouldn't be. So what they need to do is actually to, again, going back to the balance. Some people, they say their weakness is their family, and their family are far from them. They're worried always about them. Now, this is an issue that they may say, well, this individual is going to be distracted a lot, especially with the Syria issue. You want to avoid bringing that issue unless you're able to, your family with you, you want to spend more time with them, you love to be with them, but you can, they're with you right now, so that shouldn't be an issue with that weakness. So it's resolved. Those are examples you can use. These are off my head, but I don't know if they're as good as. But think about them.
Another question, it says, what do you think about a better answer to tell me about yourself? I think tell me about yourself. The answer to this question is going to be very long. I would recommend that you go back to the YouTube videos from the last year and the year before. We had Dr. Shadi Lata. He answered all these questions, and people who are in the practical sessions, inshallah, they will have that answered very well. But I would recommend you go back to the YouTube videos from the last 2 years, and you'll find the answer for that. Um, what resources do you recommend to best prepare for interview questions? Um, any suggestions, Dr. Tariq?
YouTube. YouTube has a lot of material.
Okay. I'll go back to Detroit. I think they have a lot of questions. One of the questions, the Dr. Sankari, you said something about lazy sit in your slides. Can you just explain that a little bit?
Did I have lazy set? I don't know if I have that.
One of the things to avoid is the lazy sit. Or you
I think that
mentioned.
was me, actually.
Oh, you, Tariq? Okay, I'm sorry.
so يعني ما بدك مثلا تقعد بالكرسي شبه متشطح، ما بدك تقعد بالكرسي ظهرك محني. This kind of stuff, things that make you look like an old man, kind of. أو مدبل عيونك، يعني you have to really actually be sitting up مثل الصقر، عيونك مفتوحة، kind of back straight, legs together.
Yes. So another question says, should I send a written thank you note to each person interviewed me? The answer is yes. Each person who interviewed you deserves a thank you letter, either by email or by mail, and you should do that as soon as possible. Most of the time, I would recommend within 24 hours, so you can start working on it after you leave from the program, from the hospital. You start working on it and make sure you send them definitely within 24 hours, because if it's longer than that, then they will be busy. They will not look at the email because they will be busy interviewing more people, and then your email will most likely will not be read. And especially if it's a weekend or something like that, then it's going to be um, a problem. So, can we ask the program, what are your goals in improving the program in the future? Is this a good question to ask, Dr. Sankari, that we ask the program?
It's a tricky because then you're implying that their program need improvement. So you can actually rephrase it and say, what are the changes you anticipate to occur to the program in the next few years? Are there going to be changes to the program structure? So these are okay, but not to show them that there's a problem and the program need to be fixed.
Mm-hmm. One more question to you, Dr. Sankari. What's a good excuse for old year graduation? Like if someone has graduated 5-6 years ago.
Yeah, we see those. So, and it's actually not, usually it decrease, it put more pressure on them to be, when they compare themselves with fresh graduates. And the reason is their ability to adapt and learn will be affected. Unless they can actually show they have certain skills and ability to, and adaptation to adapt to that program. These are weakness in the application. So one thing they will say is actually, so if they, for example, I have a recent candidate who came and he had 3 years gap, and he was working. So, and the reason he said, and when I asked him that question, he said, I had to support my family. I have a sister who wanted to go to medical school, and I had to support her. And I think the committee was convinced that that was a legitimate reason, because otherwise you go to work and then apply for training again. Or if you have residency done before you come here, and that's known. So people want to go to training, and then you're looking for an opportunity to improve your education. So you applied here, and so you have to highlight your ability to be an excellent trainee if they take you.
So another question, I think there were two questions about the same thing, about all the graduation and the gap. Another question, it says, do you recommend specific recommendations or talks to follow during dinner interview? Usually dinner interviews are most of the time are casual. I would recommend that just go be yourself and enjoy your time. In the same time, try to know the people and try to show them that you are a social person. That's I think the main thing is that they want to know if you are a social person or not. They want to know that you are someone who's easy to talk to, who's easy to get along with. They want to know that this person that we are hiring will be a good fit with the whole with everyone in the program. I think that's the main thing with the dinner. And at the same time, they wanna see how you act and how you react to questions. So just be yourself and enjoy your time. Um, um, so Another questions. One question says, if I have a low score in step 1 and high score in step 2, CK and CS, how does that affect my interview, Tariq? If you have like one score that's low and all others are uh, are good, so how do you explain one low score?
In general, that should not be a problem because they looked at your scores and based on their criteria, you qualify. So I don't see that necessarily as a problem. If you already got the interview, that means they already addressed this, and it's not, for the most part, it's not an issue. Now, if they do ask you why is your step 2 higher than your step 1, then you need to prepare like a kind of a common sense answer that I'm much better in clinical things, and I took my step 1 in my 6th year or after graduation. The last time I read basic science was like 3 years ago or 4 years ago. So, I mean, it follows like a common sense kind of thing. It might be a little bigger issue if it's the other way around. Your step 1 is very high, your step 2 is low. In which case you have to like find out why your step 2 was low, basically. But as I said, I mean, that usually is not a problem. If you got the interview already, that means you fulfilled the criteria.
Another question, what's the best answer for if you are applying to a different specialty? Well, I think we already answered that. I think it's illegal that they will ask you about other interviews or other specialties you are applying to. Another question, some programs are starting a new untraditional way in selection process, open house instead of interviews. If there is any advice or tips about that, it would be much appreciated. أنا صراحة I'm not familiar with this open house. This is something new. Any one of you, Dr. Tariq or Dr. Sankari, want to talk about this, or if you have experience with it?
I don't have any experience. Actually, I would recommend whoever asked the question to kind of give us specifications. We can ask people and get back to him from my perspective, and it would help some other people.
Dr. Sankari, do you know anything about this?
This is the first time I hear this, actually. I'm not aware that there is an open house instead of interviews.
Yeah, this is my first time. Yeah, I think it would be great if someone can share this information with us, and then maybe we can discuss it on Facebook. Another question, if I want to do fellowship but not determined yet, which fellowship? Is it okay not to say I'm not determined? I would say just go with the general. Like if you are applying for internal medicine, just say I want to be a hospitalist. I want to be a primary care, and then within 6 months, after you match, and then you go to the program, and then you tell them, you know what, I like cardiology, I like hematology, oncology, and I want to be a hematologist. This is not a problem at all. I think that's always the safe way to go is to be a primary care or to be a hospitalist. I think that's the safe way if you are not if you did not determine your fellowship. And most of the people they don't. Most Americans they don't know what fellowship they like. They go through residency and they have no idea what fellowship they want, and then maybe in the last 5 days before fellowship application start, they say, "Oh, now I want to do this," and then they apply and they get matched. So I think it's not a problem to say that you want to go with a primary care. Another question, it says where I would get the email address for the interviewers. Well, you either ask them you ask the coordinator about their emails, or they will offer you their business cards. If they offer you their business card, that's good. Keep it and use the email mentioned on their business card. If they don't, most likely the coordinator will give you the names and the emails of all the people who interviewed you. If she doesn't, or if he didn't, then I would suggest you ask her or you ask him to send you their emails. The last question is, how important is body language at the interview? How should we act about it for preparation? I think, Dr. Tariq, you talked about this a little bit. Do you want to talk a little bit more?
Yeah, it is actually. It is in general. It is a part of your communication skills. The way you talk, the way you look, the way you behave. As we said, you communicate. It's all a part of the same process. I do encourage you, actually, there are a lot of YouTube videos that talks about body language during interviews. If you want details, then you can go to those. In general, what you want to look at, like as a general rule, you want to look confident, but not arrogant. You want to, you don't want to do things that are known to be wrong. For example, انك تتكتف, انك تلف رجل على رجل. Those are things that you definitely have to avoid. The usual stuff is when you're sitting down, the best thing to do is back up. The back is straight. Legs are together, close to each other. Hands on the sides, like on the chair arms. When you stand up, like usually you have a folder in your left hand, and your right hand is always free, and don't chew gum. I mean, those are the general kind of consensus kind of postures. But yeah, I mean, as far as you don't do anything majorly wrong, I think you should be fine.
I think we're almost done with the questions. The last question I have from Detroit was, can we call the coordinator by first name? What do you think, Dr. Sankari?
If it's first time, some people don't like that. So if they can call her Miss or Mrs., so that's another thing. So if they don't know if she's married or not, or they can call her Miss Johnson, or that's show more respect for someone seeing first time. If they met her before and this is their second time, and she introduced herself as so and so, and that's okay if they know her before. But the first time, I would suggest to use Miss.
جزاكم الله كل خير. I think I'm gonna finish. I think we answered all the questions that we received. I want to thank everyone. I want to thank first, of course, SAB's Education Committee, who allowed us to do this interview skills workshop and the webinar. I would like to thank Dr. Abdulghani Sankari for giving us some of his time on Sunday morning to give this lecture. Of course, I want to thank Dr. Tariq Youssef for this great and very nice presentation. And I want to thank all the moderators, the instructors, and all the people who are attending the on-site workshop. I want to thank all of you for coming. I think what we're going to do now, after we finish the webinar, we will allow the moderators to talk more about it. And thank you so much.